Ooh, nice.
It really helps foot and ankle pain. Good, face up. Perfect, other side. Exhale. Good. Hey everybody, got Angela in today. She's been a patient for years now, right, Angela?
Yeah.
Okay. We wanted to do a video on her because she's 67 years old. You wouldn't know it. You'd have no clue. She's as active as anybody. She belongs to Alpha Elite Fitness still, right?
Yep.
Which so she's doing functional movements there. She's not just doing aerobics and machine work, although that would be great. Anything's better than nothing. She's actually doing, squats and deadlifts and pull-ups and this and that. And she's active, grandkids, and so many other ways, and she takes care of herself. That's the main message here. She uses chiropractic preventatively. She uses, she does supplements, and she watches her diet, and she uses essential oils and all these different things to take care of her body, to maintenance her body, so that it functions at a high level, and that it does it not just, when you're young, but throughout the course of your life. Because if you do that, if you try to maintenance and be preventative, your body will, reward you, and you'll stay healthy longer. So, and she's a testament to that. So we're gonna go over her full spine adjustment. Is anything bothering you today?
Yeah, my lower back and my neck.
Okay, so she's low back and neck pains why she's in, but she does come in even regularly when she's not in a ton of pain for her tune-ups and her maintenance. Even when she comes in, sometimes she's like sore from the gym, from doing, whatever they're doing workout-wise, and the adjustments keep her able to continue to work out, because that's so important. So we're going to do soft tissue on her low back. We're going to do a drop work and our normal stuff here. Take a nice deep breath in. Exhale. Good. You okay?
Yep.
Come down towards me just a little bit more. Because her neck's bothering her, we'll do a little soft tissue up in her neck. We're just working on some of the muscles, stripping out adhesions. I feel like the extra soft tissue work goes great with the adjustments. Take a deep breath in again. Exhale. Okay, good. Go on your side facing me. Are you adjusting your feet too?
Oh, sure.
We have in the past, right? Or my mistake?
Yeah. No, you have.
Take a deep breath in. Exhale. Real light here. Perfect. Other side. Deep breath in. Exhale. Good. Face up. Just relax your shoulders. Let your hand up. Perfect. And this one, same thing. Let your shoulders drop down. Good.
Ooh, nice.
Hang on. Deep breath. Exhale. Drop. Good. Good.
Ooh, nice.
Good.
There it is.
And we'll do your... So we do a lot of feet and ankle pain, foot and ankle pain. Before you go see a podiatrist, an orthopedic, if you're getting foot or ankle pain, you've been good recently, right?
Oh yeah.
We're just doing this for maintenance, but
yeah.
It's something. So if you're watching this and you have, plantar fasciitis or a history of sprained ankles, or you're trying to work out or walk and you're getting pain through the foot, a lot of times the tarsal bones can be shifted or misaligned, and we use this activator tool. Patients really respond really well from it, and it really helps foot and ankle pain. So it delivers like a rapid impulse. So in this case, we're working on her, like what's called an navicular bone that kind of can drop. So there's ways to adjust it manually, but I like this tool. It's very, it's gentle. It also hits the plantar fascia ligament that attaches to her calcaneus and then up into her metatarsal. So we're kind of just hitting the arch of the foot. There's 3 arches. The main one obviously is through here. So it kind of just reminds those proprioceptors that there should be an arch in there. We kind of hit this middle metatarsal arch that we also should have right in the middle. And then the third one out here. Okay, same thing over here. Hit the arches, hit the navicular, cuboid, calcaneus. Hang on to the table. You're good right there. Just relax your leg. And this one. And she's all done.